Now let's talk about some very simple procedures that could save you an awful lot of money and keep things very, very simple. And one of these is referred to as enameloplasty. And this is where you remove incisal enamel on the edge of the teeth to improve the aesthetics. Now let's look at Kathy, a 78-year-old female. The suggested treatment on her was extraction of the upper teeth because the teeth were unesthetic and the patient couldn't afford crowns. The actual treatment was enameloplasty and an upper or maxillary partial denture. Let's look at the aesthetics on these cases. See how these teeth are extruded and uneven and a very unpleasant smile? And on the lower slide you can see the two central incisors, one of them is longer than the other, presenting a very unesthetic appearance. So what we can see, you can see where we've drawn a pencil line on the incisors and laterals on the left on this slide. We went in and removed that much enamel using a dental diamond. Took about a minute, and this is the way she looked once we had done that. That may not be dramatic, but then look at her appearance on that. And I'll be honest with you, this procedure takes so little time. When I was in practice, I did not even charge for that. And so you can see the difference. We've talked about crowning the upper teeth to do this at $1,000 each. And here we've got this, we've saved her upper teeth, and now she can have a partial denture. And let me tell you what, this is one happy patient. Here we have Janie, who's a 71-year-old female, and you will notice that there is extreme extrusion of these upper teeth. Typically, all of these teeth would be removed and implants would be placed after adding bone in the sinus. And you would probably have invested $15,000 in this upper area. And you would still have to have implants or restoration placed in the lower. But let's look and see what an exaggerated form of enameloplasty can do. This patient, using our Miller-McIntyre scoring system, scores an 8. An 8 means these teeth, if they're maintained, have an 81% chance of surviving for 15 years. But if we go in and do treatment, we can see that it can be improved to 90%. Teeth can be saved, and the patient can save an awful lot of money. These two video lectures, number 1 and number 2, on the Miller-McIntyre Periodontal Prognostic Index can be found on the web textbook. So let's look at what we're going to do. Remember how we did the enameloplasty on the tooth before on Kathy? If you'll see this, you will note that we are going to remove more than just the enamel. We're going to expose the dentin on this. And we do not want the patient to be sensitive. So what we did is went in there, and this is where we started, and you can see on that first molar that there's only a 5 millimeter space. So by extracting the teeth and putting in implants, we could create the space that we want. But the object is not to extract those teeth, it's to save them. And so after doing enameloplasty, you can see that we have created a space of 9 millimeters where the patient not only maintains these upper teeth, but also simplifies the treatment plan on the lower. The occlusal adjustment to create the space for the restorations needs to be done very, very carefully. It is done to establish a more favorable biting surface so that the opposing teeth can be restored, or the occlusal adjustment to create space for restoration. This aids in establishing a more favorable biting surface. It's an effective way of treating extruded teeth, as you have seen. But how do you do this? And this is extremely important. First of all, you do not want to do this on anesthetized teeth. You need to do it before teeth are anesthetized. For as you do the polishing, if the tooth begins to get sensitive, you automatically stop, because we do not want to create a sensitive tooth. And obviously, if the tooth has been anesthetized, you may go too deeply and end up with a tooth that is permanently sensitive. Second, stop adjusting at the first hint of sensitivity. I think that's very obvious. That case and the next case were treated by Mary Lee, one of my resident students. Helen is a 71-year-old female, and her concern is, on these extruded teeth, that typically these would be extracted, bone grafting done in the sinus, and implants placed. And doing that in the maxillary arch probably would be around $15,000. But her concern is, I have a serious sinus problem, and I'm afraid to having those metal implants put in my sinus. Do we have something else to offer her? And if you look on the lower down there, where those root tips are present, the question is whether those teeth could be salvaged, or should we have 3 or 4 implants put on the lower down there, adding another $12,000 to $15,000 to the case. This could very easily be a $30,000 or $40,000 case if all of these teeth are removed and implants placed. So let's see what alternative treatment we did on this and something you might consider. Notice the root tips present here, and when we look at them, we see the same root tips where crown lengthening surgery was done and an implant done. And this is lecture 14 on crown lengthening, which is about a 17-minute video, which any dentist can look at and learn how to treat this particular case. So this is where we started, and after the crown lengthening and placing crowns on the upper teeth and placing one single implant, as we noted here, we had this level of function. The bicuspid is 10%, or the premolar. The other premolar is 10%, and this has 60%. But by sacrificing that upper second molar, here this 71-year-old patient has 80% function. And the question comes, if you're 80 years old, would you be satisfied with 80% of everything that you had when you were 20? And I think you know what the answer would be. So on the lower, 10%, 10%, and 60%. So rather than 1, 2, 3, 4, 5, 6 implants placed, only one has been placed. So the fee, if crowns were done up there, $1,000 each and $4,000 for that implant. And with 5 crowns, $5,000, implant, periodontal surgery, which is the crown lengthening surgery, you got a total of around $13,000. Or we can come into implant treatment, $24,000 for the implants, $3,000 for the sinus surgery, or a fee of $27,000. And certainly maintaining these teeth, given this level of function and aesthetics, is certainly a consideration in the mature patient. This is Richard, one of my favorite patients, who's an 80-year-old male, and you can see the periodontal disease, extruded teeth, and because of the aesthetics and severity of the problem, the treatment plan was upper denture and a lower denture. But his chief complaint, as you would expect, my wife refuses to kiss me. And you can see on the lower canine down here the pus and infection on this tooth that is going to necessarily be removed. This is after that tooth had been removed and 2 upper teeth were removed, and you'll notice on this lateral that the immaturity there on healing, which will be taken care of in time. Here we see the lower partial has been done, and you will notice that there is a clasp on that canine there, and then we will go ahead and place an implant where that tooth was extracted, and you can see that he has a combination partial with a clasp and an implant that probably saved him $2,000 or $3,000. But how retentive is that partial? Look at Richard trying to get it out. And is that one happy patient? Fixed versus removable. Let's go off and talk a little bit about that, because all patients want something that, quote, won't come out, that's fixed. Research has shown that this is very important on the younger patient, but the older patient really prefers that this can be removed so that they can clean better. So a fix means can't take it out. And this is more psychologically appealing than it is an actual necessary treatment. But there are certain advantages to a removable treatment plan. First of all, the treatment can be completed in far less time. Second, much easier to clean and maintain because it can be taken out and cleaned. Number three, it can be very stable and functional, although it is not fixed. It typically is less expensive to do and typically will snap to place and not wobble, which is one of the concerns that patients have. Finally, it is simpler and less expensive to repair. So there are many advantages to have something taken out, but certainly if the patient prefers something fixed, that can be done. But we need to involve the patient in the treatment options and let them select the treatment plan. Another very interesting gentleman. He's 80 years old, and his chief complaint is, my girlfriend wants me to get my teeth fixed, and I think you're going to see why. I say this is an interesting fellow. He is 80 years old, and his main job is ferrying yachts from Charleston down to Fort Lauderdale, South Florida, based on the season, and bringing them back. So he ferries these boats up from, say, Fort Lauderdale to Charleston in the fall, and in the winter he really does not have a lot to do, except he is a ski instructor at Beach Mountain. So here we have an 80-year-old fella who is just as healthy as he can be. And like I say, he's got a 59-year-old girlfriend, and she wants his teeth fixed. So he is being motivated not because of his own aesthetics, but because of his girlfriend. He also says that he wants to look like he did when he was 30 years old. So here he is in his 80s, and this is what he wants to look like when we're through. And the question is, can we produce this with a fixed restoration, or can we do this with a simpler, less expensive, removable restoration? Now we look at the upper teeth, and there are 1, 2, 3, 4, 5, 6, 7, 8 teeth up there. And on the lower, he has 2 premolars down there, and that offers 20% function, whereas on the other side, he has the 80%. And here's a quote that I think from my website that is interesting. A treatment plan is a journey, subject to change when circumstances change. It requires flexibility on the part of the conscientious and caring dentist as well as a trusting patient. And we'll talk about that in just a minute. So what are the treatment considerations on our ski instructor and yacht captain? Age and health. He's an 80-year-old male in good health. And the length of treatment is shorter if we do something removable rather than longer. And certainly when you're dealing with an 80-year-old, you want to do things that take less time. The periodontal status, healthy Miller-McIntyre score. And remember, there are 2 videos on here on the Miller-McIntyre score. One is how it was developed, and the second is on how you score on that. So from a periodontal status, although he has some badly broken down teeth, he's got a 96% chance of keeping his teeth for 15 years if he will abide by the keys to success. Aesthetics is a major concern. Remember, he's doing this to please his girlfriend. The patient wants a removable. The financial considerations are not a major concern because I think he makes a pretty nice income ferrying those yachts, and he is a retired military helicopter pilot. Finally, and a real complication on this is that he bruxes, and this is clenching and grinding, and so that can have a very negative impact, and that was taken into consideration. Now let's talk about an implant treatment plan or a crown and partial treatment plan. We can see that there are 1, 2, 3, 4, 5, 6, 7, 8 teeth. Some of those more involved teeth were removed, and we can see the crowns placed on top of that. With 5 crowns, an upper partial, and some crown lengthening done to expose more solid tooth structure for retention, we've got a case fee of $9,000. However, if we kept 5 teeth up there, the extractions of the rest of the teeth would be about $750, 5 implants, $20,000, an upper denture, $2,500, and a total cost of $23,000. So here we see the amount of money that can be saved if we focus on saving teeth. And on the lower, this is where we're talking about a conscientious dentist treatment plan being altered. Here we see, we mentioned earlier that the 2 bicuspids provide 10% function each, whereas on the other side we've got 80% function. The patient elected not to have an implant placed behind those premolars, which would give him 60% function. The idea was to go ahead and complete the case, and if he felt he needed an implant, we could certainly go ahead and add that. But he was very satisfied with what he had, and we did not place the implant behind those 2 premolars. All patients say, I don't want to show metal. But here is the same gentleman, the ski instructor, and you can see the metal showing on that bicuspid. Look at the metal we see in the palate, but that does not show, as you will see. And you will notice that we left a space where the speech would be improved, and rather than talk like this, like he had a plate in the roof of his mouth, he was able to talk normal. So this is the final case, and it will show very little metal, although you see a slight amount in the back. However, when he smiles, you don't see that. And I think he does look like he did when he was 30 years old. Now let's talk about the all-on-4 implant case that you've heard so much about. You have seen advertised on television the clear choice technique, and this is where you go in and have your teeth removed and you walk out there with teeth in your mouth. And Americans want immediate gratification, and this appeals to them. But let me show you what is done when an all-on-4 case is done. This gentleman is in ideal periodontal health. He has no dental caries to speak of. And his chief complaint was, I had some of my upper teeth pulled, and the extractions were very traumatic and broke off. So he decided that he would come to the university where he would be treated right. So let's look at how the university treated him right. As we look at these teeth, we can look at all the teeth on the left, which are periodontally healthy, no restorations need to be done. And on the front, you can see the extreme wear and the malocclusion that resulted from that. But if you will notice on the right on the picture, all of those posterior teeth have been removed. The premolars, the first and second molars, 4 teeth were extracted that were periodontally healthy, and so we can understand why all those teeth were broken off. But there was no need to extract those teeth. And by extracting the teeth, let's see what resulted. First of all, there were 8 surgical extractions done where all the teeth were removed, in addition to the extractions that were done in private practice before he came to the university. So therefore, 8 extractions would be $1,200. And the Miller-McIntyre score, as we've talked about before, he has a 96% chance of keeping the teeth, which were extracted for 15 years, 93%, because there is no caries or cavities present, and wear is his only problem. So these 4 teeth could be crowned for $1,000 each, and we would have a $4,000 case fee, and the patient would have basically all of his teeth. But this was what was done. This is what it looks like when you have a clear choice, and they do the all-on-4. And we look on the left the way he looked before, and the day where the 5 implants were put in, and remember, implants are $4,000 each. So he's going to spend $20,000 just on having the implants placed. But he's going to have a hybrid denture, which people describe as a hybrid, but they often fail to tell the patient that is a denture. And the total cost would be $17,000 compared with a $4,000 treatment plan where the patient was allowed to keep all of his natural teeth. So here we see an x-ray on the left preoperatively, and we can see on the right where all those teeth have been extracted, including the bridge that we see on the x-ray. I had some of my upper teeth pulled and they broke off all the roots. So I wanted to come to the university where I would be treated right. My question to you, was he treated right? Let's look at a similar case. Look at the wear on the lower right. Look on the left where the canines look like fangs. But by going in there and doing the crown lengthening that we have talked about so many times on this tape, we can see how much tooth structure is removed. So when crowns are placed on those teeth, the crowns would have much more tooth structure to grip to. But you need to have that much tooth structure to grip to, so crown lengthening offers that. Now, if you're going to do crown lengthening on a single broken tooth, that's one thing, and at our university we teach the dental students to do that. However, when you're crown lengthening multiple teeth like this, I think it would much prefer to go to a periodontist who has much more experience doing this rather than the general dentist. Here we see preoperatively and the healing that took place in about 3 or 4 weeks, and now the teeth are ready to be crowned. And this is the way the crowns look down there, and the option, perhaps it could have been done, was all of these teeth could be removed and 4 implants placed down there. This could be a $20,000 case, or 2 implants in the bridge and be a $12,000 case, or it can be a $6,000 case by simply doing the crown lengthening and crowns. Now we look at the upper teeth, and we want to get rid of that fang look. The teeth are too short, and now on the lower slide you can see where crown lengthening has been done and new crowns can be placed, and they can be long enough and give the patient a much more aesthetic look. And on the upper right you can see where crown lengthening was done on those 2 premolars, which remember we said offered 10% function each, and then the crowns placed. Here we see where we started, where the canines look like fangs, and here we see after the crown lengthening done and new crowns done, and you will notice that the canines do not appear as fangs. Now in closing this segment, I would like to offer this quote. When I was young, I had to force myself to not lie. Now that I'm old, I have to force myself to tell the truth. And hopefully in these series of videos that I have told you the truth. I'm not being critical of any dentist who may not be aware of some of these procedures, which by looking at the video they can become educated. But you as a patient have an obligation to ask the dentist what treatment options are there for you, and perhaps mention some of the things we've seen here, and offer to suggest to the dentist that they look at the website and look at these techniques and learn how to do them, or to refer you to a periodontist who will be more than happy to accommodate you and actually has much more experience and can do these better than the general dentist.